The World Bank defines governance as the way power is exercised through a country's economic, political, and social institutions. Governance involves exercising authority to manage a country's economic and social resources and implementing policies to ensure stability and development. We mostly focus on national governance in our study. This is the internal governance of a specific country. Global governance is also relevant, especially in countries that rely on international aid for resources and development. There is also clinical governance, the way health systems and individual hospitals are managed. The World Bank has created the Worldwide Governance Indicators, which define 6 dimensions of governance: voice and accountability, political stability and absence of violence and terrorism, government effectiveness, regulatory quality, rule of law, and control of corruption. The determinants of health that are most influenced by governance quality are socio-economic environment, physical environment, education, and health services. There is an obvious disparity in both governance quality and the quality of healthcare between developing and developed countries. Here is a comparison of the worldwide governance indicator scores of the 3 regions that we studied. So let's make this a bit more real. Imagine you're setting off to travel and experience the world. What would you encounter in terms of health systems around the globe? And how would you feel about availing of health services in different countries? First stop on your journey is Sub-Saharan Africa. Sub-Saharan Africa's performance on health outcomes remains poor, despite the nation's financial commitment, albeit limited, and foreign aid. There is widespread poor service delivery, poor procurement systems marred by mismanagement and corruption, and poor health infrastructure. Indicators for health outcomes show slow progress in Sub-Saharan Africa. Africa spends the lowest on health expenditure per capita. However, spending per capita is increasing faster over time. Even if health status in Africa has improved over the last 2 decades, Africa remains an unhealthy continent. Life expectancy is 59 years, the lowest worldwide. It has the highest rates of infant mortality at 66 deaths per 1,000 and the highest under 5 mortality rates. In 2010, Sub-Saharan Africa spent 6.5 of its GDP on health, which was below the world average of 10.5. If the basic principles of governance in healthcare delivery are not observed, priorities cannot be met and scarce resources are wasted, and well-intentioned spending may have no impact on health outcome. Poor government funding is a major contributing factor, as the effectiveness of health interventions is related to the availability of resources. As a result, health outcomes correlate with donor support. While international organisations should ideally be driven by member states' interest, the determination of health priorities by international organisations leads to an imbalance between the set priorities and prevalent health issues in various countries. One may wonder whether the presence of cooperation and international organisations addressing health matters at a global level does not breed heavy reliance on such organisations and in turn result in diminished capacities for developing nation-states. Next stop, China. Although there have been improvements to healthcare in China over the last 30 years, it still has some major problems throughout, one of which is the gaping inequality between the quality of urban and rural healthcare. In China, there are 5 levels of government with significant healthcare responsibilities. This greatly undermines the central government's capacity to fulfill its steering and stewardship functions. Urban and rural local governments are responsible for healthcare under their jurisdiction and receive little direction and even less funding from higher levels. The quality of healthcare that residents receive depends on their local government's fiscal and administrative capacities, which vary greatly across the country. In China, the scope for collective actions of citizens is particularly small due to various restrictions on civic and political activities. As a result, citizens that interact with the health system have virtually no voice in its development. However, since 2006, China has been undertaking the most significant healthcare reform in recent times. The government launched its new rural cooperative medical care system in 2005, particularly intended to make it more affordable for the rural poor. Under the new system, some 800 million rural residents gain basic medical coverage, with the central government covering between 30 and 80% of regular medical expenses. Availability of medical insurance has increased in urban areas as well. By 2011, more than 95% of the total population of China had basic health insurance, though out-of-pocket costs and quality of care have varied significantly. The health infrastructure in Beijing, Shanghai, and other major cities were approaching developed world standard. and are still vastly superior to those operated in rural areas. And finally, back home to Ireland. Ireland performs well in terms of governance and health outcomes. The infant mortality rate is 3.7 deaths per 1,000 live births, and the maternal mortality rate is 8 per 100,000. If you live in Ireland, you can expect to live for an average of 81.5 years. This puts Ireland 19th of 195 in the world rankings. The healthcare system in Ireland is governed by the Health Act 2004, which established the HSE to be responsible for providing health and personal social services to everyone living in Ireland. 75% of money spent on all healthcare comes directly from the government. In 2017, the budget allocated for healthcare was €14.6 billion, the biggest health budget in Irish history. A new initiative provided by the increased 2017 budget is the Healthy Ireland Fund. This fund aims to address prevalent problems which are the main causes of disease and mortality in the country today. Problems such as obesity, mental health, smoking, alcohol and drugs. Healthy Ireland seeks to provide people and communities with accurate information on how to improve their health and well-being, and seeks to empower and motivate them by making the healthy choice the easier choice. The Irish government also provides some of its citizens with medical cards. Medical cards allow people to access family doctor or GP services, community health services, dental services, prescription medication costs, hospital care, and a range of other benefits free of charge. So, what does this all mean? In general, good quality of governance means better health services, education and physical environment and socio-economic environment for citizens. This means a higher standard of health. Thus we can conclude that governance quality is an indirect determinant of health.